I am Dr. Muskaan from team MDS CONQUER. In this video, I'll be discussing about psychodynamic theories of child psychology. So first of all, child psychology and behavior management, they are a very important part of pedodontics, and most important of all, it does not overlap with any other subject. You have to cover this in pedo only. And the second thing is that you are most likely to get 1 or 2 questions definitely from this part. And I know most of you must be thinking it is a very dull or boring subject, but you just need to understand the crux of the theory, and the part from where you get questions is, most of the questions is, first is the classification of the theories, then you have to remember the scientist who has given the particular theory, the year in which the theory was given, the stages, all the stages that are covered in the theory, and a bit of the dental application of the theory. So to start with, some points to be remembered. So the work of Darwin on the principle of natural evolution focused the scientists' interest on human development. Mendel's contribution on genetics in 1863 influenced certain movements towards the study of children. Pavlov contributed on developing the experimental technique of the conditioned response. Freud's work had major influence in understanding concepts of psychology. So scientists basically they are more important from PGI point of view. In these papers they concentrate more on scientists. So what is the importance of child psychology? To better understand the child, to know the problem of the psychological origin, to gain the confidence of the child and the parents, and to produce a comfortable environment for dental team to work on the patient. So there are different models. There are 4 models put forward to understand the development of a child's behavior. So we have not got any question from these models till now, but you should know the name of the model and the theories which are based on these models. So you should know about these models. So first is the mechanistic perspective. This is known as the mechanical mirror model. It equates people with machines. So according to this, humans, they react to what the environment makes out of them. So the social learning theories, they are based on this model. Next is the organismic perspective, which is known as organic lamp model. So according to this, humans initiate acts. Change is inherent part of life, which is internal rather than external. That is, there is no environmental influence on the development. So the Jean Piaget's theory, it is based on organic lamp model. According to this, change is qualitative and discontinuous. Next is the psychoanalytical perspective. It was first developed by Sigmund Freud. So according to this, people, they are neither active nor passive, but they are always in flux between the 2 states. So they are always in a conflict between their natural instincts and constraints imposed upon them by the society. And Sigmund Freud's theory and Erik Erikson theory come under this. So next is the humanistic perspective. So this perspective sees people as having ability to take charge of their lives and to foster their own development. It emphasizes the individual's ability to do this in healthy, positive ways through the distinctive human qualities of choice, creativity, valuation, and self-realization. So next is the classification of theories of child psychology. This is very, very important. So basically they are divided into 2 types: psychodynamic theories and behavior theories. Psychodynamic theories, they include psychosexual theory by Sigmund Freud, psychosocial theory by Erik Erikson, and Jean Piaget's theory of cognitive development. Next are the behavioral theories. They are the classical conditioning theory by Ivan Pavlov, Skinner's operant conditioning theory, Bandura's social learning theory, and hierarchy of needs by Maslow. Now, what questions you can get from these? They can give you 4 options, and they can ask you which of the following is a psychodynamic theory, or which of the following is a behavioral theory, or all of the following are behavioral theory except. So you need to know the names, know the class in which they fall, and know the year and the scientist who has put forward that theory. So first is the psychosexual or the psychoanalytical theory put forward by Sigmund Freud in 1905. So he attempted to explain by understanding the mind at its different levels, its motivation and conflicts. So Freud described human mind with the help of 2 models. First is the topographic model, and the other is the psychic model or the psychic triad. Now, according to the topographic model, there are 3 levels of consciousness. First is the conscious, then is the preconscious, and then is the subconscious or unconscious. Conscious is what we are aware of. Preconscious is that part of the personality of which the individual is not aware of at the moment, but can recollect into awareness without great difficulties. So this includes our stored knowledge, our experiences, and subconscious or unconscious part of the personality is of which the individual is unaware of. So Freud used an iceberg to depict these 3 levels. So this is the conscious level, which are our present thoughts, our perceptions. This is the preconscious level, which are our memories, our stored knowledge. We can recollect them at any moment when we want. And this is the unconscious level or the subconscious level, which includes our inherent fears, our irrational wishes, our selfish needs. So Freud says that only 10% is the conscious level, and rest is the preconscious and the unconscious level, and we are not aware of it. The other is the psychic triad or the psychic model. So in order to understand this, let's take an example. To make it easier, let's take example of a kid. See, this is a kid. Okay, he has a devil on one end and the angel on the other. So the devil always pushes the kid to do the wrong things, to take the wrong habits, whereas the angel always encourages to do good deeds. Now if we see this devil as the id, the child as the ego, and the angel as the superego. So id is first to develop in life, then comes the ego, then comes the superego. Now what is id? It is the selfish person inside us, which is based on the pleasure principle. That is, all its needs should be fulfilled instantly. That is, it believes in instant gratification. What is superego? Superego follows the rules of the society. Now, the ego is always confused how to satisfy the needs of the id while keeping in mind the rules of the society. So it is the ego who acts, and it is the ego who has to face the consequences. It is the ego who has to make the decision what to do. So id, it is present at birth. It strives for immediate pleasure and gratification. Ego, it comes at 2 to 6 months, delays, modifies and controls id impulses on a realistic level. and the next is the superego, that is prohibition learned from the environment. So it is our unconscious mind, ego is our preconscious mind, and superego is our conscious mind. Now Freud says that throughout the life a person goes through 5 stages, and during all these stages there is a zone of erogenous zone. So there is a constant struggle between it and the superego, and ego has to balance it. These are known as the internal conflicts, and the result of these struggles, the decisions of the ego, they decide the personality of a person. Now Freud put forward the 5 stages. This is very important. What you have to know is the name of the stage, the age group of the stage, the zones of focus, gratifying activities, and the fixations. Now fixations are, if the child continues to struggle through a stage, then he develops certain fixations. So according to Freud, most of the personality, it is completed by 5 years of age, that is in the first 3 stages of life. So first is the oral stage, again age 0 to 1.5 years. Erogenous zone in focus is mouth. Gratifying activities, nursing, eating, mouth movements. So if the infant's needs are met, like if the infant is getting sufficient feeding, then infant develops into a better person. But if there is insufficient or forceful feeding, it results in fixation. So what will be the symptoms of oral fixation? Later in the life there will be smoking or nail biting or drinking. So next is the anal stage. In this, what you have to remember, age group is 1.5 to 3 years, and erogenous zone is anus, and gratifying activities are bowel movement and withholding of such movement. So during this stage the child goes through the toilet training. That is a process through which children are taught when, where, and how excretion is deemed appropriately by society. Next is the phallic stage. So the age is 4 to 5 years. Erogenous zone is genitals. Gratifying activities are genital fondling. So the key event in the child's feeling towards the parent of opposite sex, together with envy and fear of the same sex parent. So the symptoms of phallic fixation, they will be anxiety and guilty of feelings about sex, fear of castration, and narcissistic personality in men. So it includes 2 important points. First is the Oedipus complex, in which the boys, they become more attached to their mother, and Electra complex, it is the opposite of the Oedipus complex, in which the girls, they are more attached to their father. Basically a child is more attached to the parent of the opposite sex. So next is the latency stage. It is from 5 years to puberty, and there is no erogenous zone, and during this time the child's sexual feelings, they are suppressed, and much of the child's energy, it is channeled into developing new skills, acquiring new knowledge, playing, and it is largely confined to children of same sex. Next is the genital stage. It is puberty onwards, and again the erogenous zone is genitals, and interaction with the environment is that 3 major sources of sexual arousals during this period are memories and sensations from earlier childhood period, that is from the phallic stage, then the physical manipulation of genitals and hormonal secretions. Now, what are the merits of Freud's theory? It is one of the earliest theory. It is the most comprehensive theory of lifelong psychological development. Then the demerits. Freud formulated this theory by his extensive studies on adult psychological patients, and hence its extrapolation to children, it is not very much justified, and it is based on the obsessed observation of the psychologist. So basically what we need to remember in this study is, first, it was given by Sigmund Freud in 1905. Second, the two models, the topographic model and the psychic model. Then it includes the 5 stages, the name of the 5 stages, the age, the areas of focus, and the fixations. So next is Psychosocial Theory by Erik Erikson, given in 1963. Now Erikson, he extended the Freudian concept of ego. He developed functions by epigenetic principle, that is, we develop through a predetermined unfolding of our personalities in 8 stages, each of which depends upon successful resolution of a turning point or crisis. So Freud and Erikson, they both assume that development depends on child's instincts and responses around him. Unresolved issues from early stages of life affect person's ability to deal with subsequent stages. So according to Erikson, a person has to go through 8 stages throughout his life, which decides about what kind of a person he emerges to be. Now the first stage is trust versus mistrust. The age is 0 to 1 years and the basic strength is hope. So what we need to remember in Erik Erikson theory basically is all the 8 stages, then the name of the stages, then what are the crises or the basic strength of that age, and how the person emerges through that stage, and the dental implication of that stage. So during the first year of the life, the child is completely dependent on his mother for his needs. So if the caregiver meets the needs of the child develops trust in the later life. But if the caregiver does not meet the needs, the child develops mistrust in the later life. So what will be the dental implications of this age? So the child is basically is dependent on mother for the needs and is attached to mother, and so there will be separation anxiety in the child if we try to separate the child from the mother. So if necessary to provide the dental treatment at this early age, it is preferably to do with the parental presence and preferably with the parent holding the child, because if once the child loses the basic trust with the world, then it would be very difficult for the dental staff to regain the confidence of the child. So next stage is the stage 2, which is the autonomy versus shame and doubt. So the age group is 2 to 3 years. So the basic strength is the will. Now here there is a determination to exercise freedom of choice in face of society's demand. Now the child starts to gain some freedom of choice. So if the child is able to exercise some degree of choice, then the child comes out to be a confident person. If the child's independence is thwarted, child develops feeling of self-doubt, shame in dealing with others. So what other important landmarks of this stage are that, like, the child wants to choose what to wear, what to eat, with which toys he wants to play. So what are the dental applications? So since the child is moving away from the mother, but still the presence of the patient is essential, because the child will retreat to the parent during the threatening situation, and now the child wants more freedom. So the dentist must obtain cooperation from him by making him believe that the treatment is his choice and not of his parents or the dentist. So the third stage is 3 to 6 years, which is the initiative versus guilt. Basic strength is purpose. Now the child expresses desires to initiate new activities, like if the child will be playing with new kind of toys, will be doing more kind of activities, doing drawing, playing with blocks, making different types of things with the blocks. So if the child is appreciated and is allowed to do it, then he comes out to be a better person, to be a more confident person. But if the parents, they punish the child for this initiative, the child develops feeling of guilt, and it will affect self-directed activity throughout the life. So what will be the dental implications? That the child can be encouraged to view this visit as a new adventure. Why? Because now the child wants to do new things in this stage. So if the child is encouraged, then we can genuinely expect a success in the dental visit. That is, we can expect cooperation from the child, we can do the treatment in a better way. Then, but if the child fails to do so, it can lead to a sense of guilt in the child, and he will always run away from the treatment. So the next thing is that the child is teachable at this stage. So the child can be taught about various things in dental setup. The next is the stage 4, which is industry versus inferiority, that is 7 to 12 years. And the basic strength is competence. Now the child develops cognitive abilities to enable in task completion. That is, the child is indulging in play, work, school, making new friends, playing different sports. So if the parents or the teachers, they do not support the child's efforts, child develops feelings of inferiority and inadequacy. So what are the dental implications? That child drives for sense of industry and accomplishment. Cooperation with treatment can be obtained. So cooperation at this stage, it depends on whether he or she understands what is needed to please dentist or parents, whether the peer group is supportive, and whether the desired behavior is reinforced by the dentist. Next is stage 5, that is identity versus role confusion, which is 12 to 18 years of age, and the basic strength is loyalty. Now at this stage, now the child grows into an adolescent, and the major question that is in the mind of a child is, who am I? So he indulges into different social relationships, develop new friends, new relationships, goes out. So if there is a strong sense of identity, then the child faces adulthood with certainty and confidence. But if there is identity crisis, then there is confusion of ego identity. Now what are the dental implications? That since the child is in adolescence, so first thing is that the approval of peer group is very important. The child is more worried about what his friends will say, what his peer group is going to react on his actions. So the approval of the peer group is extremely important. Any orthodontic treatment should be carried out if child wants it and not parent at this stage. So parental authority is rejected. Child should be given the freedom to decide what treatment he has to undergo. Next is stage 6, and it is in the early 20s, and it is intimacy versus isolation, and the basic strength is love. Now the adult is indulging in some productive work, is establishing new intimate relationships. But if the person fails to establish relationships, then it leads to the isolation. So dental applications are that at this stage, since the person is getting into new relationships, so the appearances, they are very important. So these young adults, they seek orthodontic treatment to correct their dental experiences, and this is characterized as internal motivation. But alteration of appearances can also interfere with previously established relations. So the treatment options, they must be fully explained to and discussed with the young adults. Next is stage 7, which is mid-20s and late 50s. So this is generativity versus stagnation, and the basic strength is care. Now as the individual is growing, so he takes active involvement in teaching or guiding the next generation. There is a need to teach others, there is a concern for the next generation. But if there is no outlet for generativity, then it leads to the stagnation of the person. Next is stage 8, which is 50s and beyond, and it is the integrity versus despair, and the basic strength is virtue. Now this is the looking back stage, that the major question a person asks is that did he or she live a meaningful life. So integrity is when a person can look back with satisfaction. Yes, I have had a very good life, I have achieved all the goals, all my personal, professional, every goal I have, my family is settled and everything is good. But if the person reviews with anger or frustration, or they have gone through bitter experiences, or they have committed some mistakes, then that is despair. So what are the merits of Erickson's theory? It is based on age-wise classification of an individual. It is easy to apply at any stage of development. Then it is simple and comprehensive to understand. The demerits are that it is based on extreme ends of personality. So what we need to remember in this theory is the name of the scientist, Erik Erikson, year 1963. Basically there are 8 stages, the age of every stage, the basic strength and virtue of every stage, and the dental implications. Like you can get a question that there is a 1-year-old child you have to treat, so what is the main thing you have to take care of? For example, it is the separation anxiety. Then you will ask the parent to leave, or they will give different options, like the parent should be allowed in the operatory, parent should not be allowed in the operatory. So during the first year of life you have to answer yes, the parent should be allowed into operatory. Why? Because if the parent is not allowed, then the child may face separation anxiety. So these are the different questions, these are the different case based questions that you can get. So we have discussed all the dental implications, all the stages. So you can get a question mostly from any of these parts what I have emphasized on. So next important theory is Jean Piaget's theory of cognitive development, given in 1952. So Jean Piaget, he formulated this theory on how children and adolescents think and acquire knowledge. So he directly observed children by questioning them about their thinking. So according to Piaget, the environment does not shape child behavior, but the child and adult actively seek to understand the environment. So basically there are 4 stages in Piaget's theory of cognitive development. So the sensorimotor, pre-operational, concrete operational and formal operational theory. What we need to remember is the age group, then the name of the stages and the developmental phenomena that are present in that very stage. So first is the sensorimotor stage. It is birth to 2 years. So now during this stage, the child starts to experience world through senses and action. Like he is using his senses. For example, he is seeing the objects, he can touch the object, he can feel the object, he can hear from his ears. So the developmental phenomena are object permanence and stranger anxiety. Second is 2 to 6 years of age. So this is the pre-operational stage. Now the child begins to give words to the things, to the images that he was seeing earlier, using intuitive rather than logical reasoning. Next is the 7 to 11 years of age, that is concrete operational. Now he starts thinking logically about concrete events, grasping concrete analogies and performing arithmetical operations. Then is the formal operational stage, that is 12 to adulthood. There is abstract reasoning. Now to make it simple, let's see this picture. First is the sensorimotor stage, this one, that is birth to 2 years. Child can hold the water, child will drink the water, child can feel, he can put his finger and he can feel the water. That is the sensorimotor stage with his senses. Next is the pre-operational stage. Now the child can name, yes, this is water. So this is the pre-operational stage. In concrete operational stage, the child can fill the glass with water. He knows that how I can take half glass of water, how I can take a quarter glass of water. And in formal operational stage, the child knows the complete reasoning that if it is half full, then it is half empty. So this is, in simple words, what is the theory of cognitive development. Now let's understand the dental implications of each stage. First is the sensorimotor stage, that is 0 to 2 years. Now since child begins to interact with the environment, so the child can be given toys while sitting on a dental chair in his hand to make him more cooperative. Next is pre-operational stage, that is 2 to 7 years. So it has 3 parts, that is constructivism. Now child likes to explore things and make own observations. For example, child will survey the dental chair, he will see the airway syringe, the air rotor and all the equipments which have been kept there. Then is cognitive equilibrium, that is child is explained about equipment or instrument and allowed to deal with it. That is, you can show the child the mirror, you can place the mirror in his hand, yes, you can hold it, nothing is happening. You can ask him to hold a probe and keep it on his nail and says, see, it is not hurting. So child can take control of things. He should be taught and he should be allowed to exercise some independence to understand the thing, so that he will allow you to do the treatment and be more cooperative. Then is animism. Now the child will correlate with other objects which they are used to or accustomed to. For example, radiograph. A child does not know what is a radiograph, but yes, he knows what's a tooth picture because he has seen a photograph, a picture at his home. So he can relate, yes, it is showing a tooth, so it's a tooth picture. Yes, they have taken my he will be more cooperative with you. Then is concrete operational stage. One more point, you have to differentiate between animism and euphemism. Animism is a part of cognitive development. It is where a child can correlate with the object, and euphemism is a part of behavior management in which different words, simpler words, they are used for the instruments and the things in the dental operatory. Next is concrete operational stage, that is 6 to 12 years. Now a child will understand the concrete instructions like this is retainer, you have to brush like this, you have to wear the retainer at night, you have to clean it every day. Child can be instructed how to brush, like you can show a mirror and then ask the child to brush himself, and child is teachable at this stage. So centering, that is child is allowed to hold mirror to see what is being done on his teeth. Egocentrism, child has achieved level of understanding and gets involved in treatment. For example, the child can hold the suction tip by himself for you. Next is formal operational stage, that is 11 to 15 years. So again, this coincides with the adolescent stage of Erik Erikson. So there is more of peer influence and abstract thinking increases. This plays important role in orthodontic appliances and braces. And the child, they are more getting more and more conscious about their looks and how their peers they react to their looks, and basically again this corresponds to the adolescent stage of Erikson. So the merits of this theory are, it is most comprehensive theory of cognitive development. The theory propagated that we can learn as much about children's intellectual development from examining their incorrect and correct answers to items. And demerits it underestimates child's abilities. It overestimates age difference in thinking, vagueness about the process of change. It underestimates the role of the social environment. So the main things to be remembered in Jean Piaget's theory is the name of the scientist, Jean Piaget, the year, then the 4 stages, the ages at each stage, and the phenomena, that developmental phenomena taking place at each stage, and what dental implications it is having, and how we can make the kid more cooperative by understanding his psychology at that particular point. So with this we finish with our psychoanalytical theories. Hope you have understood the subject. Thank you.